This is the Real Change Wilmington Podcast, episode 42, Direct Pay Primary Care, with our guest today, Tracy Kelley.
That's a big commitment to trust somebody with your family that you love more than life. And that's what I say about my family. I tell all my patients that I have now, I'm going to treat you like I treat my family. And I love my family more than anything. So if I can't treat you well and do right by you, I probably shouldn't be doing this.
This is your host of the Real Change Wilmington Podcast, Dustin Pierce, joined with my co-host, Tiara Harris. Real Change is a positive, constructive, and lighthearted source of local news events and resources. And on our podcast, we interview leaders of local organizations to help squash rumors and encourage a greater sense of pride in our community. And Tiara was doing hand gestures as I was saying that. Now she's trying to control her laughter. She did the squashing hand when I said squash rumors. What?
I was thinking about the gopher.
Oh my God. So I told Tiara a story earlier about a gopher I saw dying on the side of Lowe's Drive. And I tried to help, and its guts were squished out. And that's what she was making the hand movement for. You psychopath.
I was making the hand movement because of squash rumors, but then I thought about the poor gopher.
Yikes. Okay. Wow.
Yeah, I know.
That's a start for the podcast. So how are you doing today? What's interesting in your life?
I don't have anything super interesting going on besides the fact that I'm doing my hair tonight. It's supposedly going to take 8 hours, so I might not sleep. It takes a really long time.
What are you doing to your hair?
I'm getting boho twists, so there's going to be a little bit of curls out, but it takes a really long time. Because I'm not going to do micro twists or even small. I'm going to do jumbo, but that's still going to take a long time, according to my mom. We shall see. She's probably correct.
8 hours. Yikes.
Yeah.
Sucks to be a girl, I guess.
Hopefully they look good, because if they don't and I spent that money and that time, I'm going to be really upset.
So you have to go somewhere to get it done?
No, she's going to part my hair, hopefully help me, because, I can't see the back of my head. And then I'm going to do my hair, because if I went to someone else, it was going to cost like $300.
How long does it stay like that?
As long as my mood stays like that. Usually it can last over a month.
How is it to sleep like that?
It's probably going to hurt. I've had braids before. I've never had twists. I've had braids.
So you have to sleep on your face instead of...
No, I have a...
special pillow?
Yeah, basically. It's like a satin pillow, and then I wrap my hair. But I do that with my normal hair anyways. It's just going to feel tight for the first few days on my scalp. It's probably going to feel really annoying.
Huh. Yeah. Girl stuff.
Yeah, I know. So tell me about boy stuff.
Boy stuff?
Yeah.
Well, as people know, I got a bike at Wheelie's that is pedal assist, and I tricked it out recently.
Yeah.
I got a basket so I can go to Kroger and get my groceries and come back and get my exercise in,
Ultimate utility.
Ultimate utility. And I put some lights on the wheels because I'm a child, and I see people in New York do it, and it looks cool in New York, and I'm bringing that here.
It reminds me of that Cars scene. When they all had the LEDs underneath them?
The Disney movie?
Yeah.
No, but that sounds like fun, yeah.
That's what I think of when you say you got the LEDs.
Nice. I hope people see me riding dirty and with my lights, and it makes them smile. It makes me smile.
You're going to bring some smiles.
So, Tracy, what was your favorite part of the podcast?
Knowing how she got into neurology, because I was wondering how she transitioned into it, because she was talking about her profession beforehand. I've always liked neurology for some reason. In no way am I a neurologist, or probably ever will be, but it's always intrigued my interest.
I think I liked the business model part of it.
Yeah.
How it's direct pay, and you don't got to go through insurance hoops and stuff to get your care. And she also sugar shamed me at the end of the podcast.
She did. She said, you asked her if she had lollipops.
Oh, yeah.
And she said yes, after she just told you not to
eat sugar.
Yeah.
Yeah. She should get diet lollipops. Say on brand.
Yeah. Ozempic lollipop.
Yeah. It was good stuff. It's definitely a new way to do healthcare. And I'm glad that she's filling that empty building on Logan Street. So a lot of cool stuff.
Yes.
Let's hear from Tracy. Tracy, welcome to the podcast.
Thank you.
Yeah, excited to have you here. So Dr. Schuschler connected us.
He did.
With Doc's Dogs. We had him on our podcast recently. So how do you guys know each other?
So he actually reached out to me. He's seen my pamphlet at, I think, Kroger, and reached out to me because we do the same kind of care. Yep, like direct primary care.
Yeah.
And he wanted to connect with me and see if maybe we wanted to work together in the future.
Mm-hmm.
since we do the same kind of stuff.
He does most like house visits though, right? Is that what he does now?
He does.
Okay.
Yeah.
Would he ever like have a shop next to you, like in your building?
I don't know if I can give all our secrets out yet.
All their secrets? Oh, man.
But I can say that there's some good stuff coming, hopefully, down the pipeline.
Okay. So your office is located in, what's the address?
825 West Locust.
Okay. So it was the old CMH residency building.
Correct.
The spooky building there that's now has your office in it.
Is it spooky?
I guess it was abandoned for a while.
It was. It was.
We went inside. It's nice.
Yeah.
It's beautiful.
Super nice. You had your open house last weekend?
I did.
How did that go?
We had a really good turnout. I was kind of a little worried because of the time of year. I mean, like it's all the graduations and getting into summer. People are going on vacation. Kids are getting out of school. But I was really impressed. We had a good turnout and people came and learned a lot about our practice. So.
Tara wasn't here when you said this, but she got a couple new clients recently. So she's doing great.
Yeah. Yeah.
Flourishing.
And
hopefully even more so after this podcast is published.
Absolutely. Get that real change bump.
Yeah.
Okay, so before we get into your practice and your new business, we like to just talk about you as a person first. So tell us your story, your background.
I went to nursing school and graduated in 2001 from Mount Carmel College of Nursing in Columbus. And then I worked in the emergency room, oncology. I did some case management. And then I taught nursing school for a little bit. And then before I transitioned back to the emergency room, I wanted to go back to being a nurse practitioner, which I always wanted to be a nurse practitioner, but it just was never the right time. Like it wasn't very affordable for me. I was raising 4 kids. So when I finally had the opportunity, Kettering was offering college reimbursement. So I went back to the emergency room at Soin and worked there for a couple of years. And then I transferred over to Southview, which is part of Kettering also. And I stayed there for about 6 years while I finished up my MP. And then I went to Cedarville College of Nursing. And then I went into neurology. And that's kind of where I've stayed.
Were you born in Wilmington?
I was.
Okay.
So you were born in Wilmington, went to college in Columbus initially?
Yeah.
And then where did you live after that? Back in Wilmington?
So I actually lived in Hillsborough for a little bit.
Okay.
And when I got married, we lived out in Newmarket. And so I started going to Southern State and did some prereqs and then ended up at Mount Carmel, which was closer to Hillsborough than most colleges, like big colleges. I wanted to make sure I got my bachelor's degree. So it was probably an hour drive there, maybe.
Okay.
Yeah.
That was for your first degree?
Yes, for a bachelor's degree.
Are you currently married?
I'm not.
Okay. But you have kids?
I do.
So tell us their stories.
Okay.
You have one who helps you currently too with your social media, right?
So Chanda is my daughter. She went to Wilmington College and she lives in Grove City with my 2 grandsons. She's 30 and then I have a son that's 29. He is the manager of the Dollar General store in Wilmington. I have a son that would be 20. He was in a car accident a couple years ago and passed away. Then I have Hayden, who is 17, and he works for Buckley's and is going to the Career Center and doing welding.
Nice. Very cool. So what are your hobbies?
So I have been working a lot lately trying to build my business, but I love to kayak. The boys and I go out kayaking a lot at Cowan Lake because it's right up to our house. So we can get in the creek and kind of paddle all the way out to the lake.
We just went to Cowan Lake earlier.
You can use our kayaks anytime. We got like 6 of them.
Awesome.
I love my pool in the summer. I like to lay in my pool a lot. I don't know how much of that I'll do this summer, but that is what I do like to do. And then I go to my mom's every Sunday and take care of her. She has an advanced Alzheimer's. So I kind of help my dad with her.
What's a defining moment of your life that has helped shape your values and personality?
I would say my kids. Just in general, when I had my kids, I knew that everything in life that I did was going to revolve around them. And I wanted to make them proud. I wanted them to see someone that has a good work ethic and be able to mimic it.
Yeah.
And then I think my mom, when she got Alzheimer's, we had tried to get some medications for her. And they were like, oh, well, if she can't really get out very well, we can't really prescribe her medications. That is typical. But it was frustrating because there's lots of patients that can't get out of their home or they have mobility issues. It kind of frustrated me a little bit. So I was like, I really need to do something. I always knew I wanted to have a private practice or run a free clinic. If I had lots of money in the world, that's what I would be doing. But I kind of reached out to my sister and I was like, hey, this is what I want to do. This is how much it's going to cost me to get started. Can you help me? And my sister and my brother-in-law were like, yes, absolutely. So that's what I did. And now I go and I do some home visits. I have several patients that are homebound. And then I have patients that can come to the office and I do telehealth or I do phone visits. So I feel like that's kind of how I got started doing what I'm doing.
So your mother's Alzheimer's was the impetus of starting your own practice?
Yes.
Pushed you over the edge?
Yes.
Is that what also motivated you to specialize in neurology?
So not necessarily.
Okay.
I would have to say neurology was never on my list of things I wanted to do. I was an ER nurse, so I know a little bit about everything. Mm-hmm. I kind of use this cliche all the time with the docs that I work with. I'm like, I know a little bit about everything, but not enough to know anything. And I say that because when you work in the ER, you kind of have to know everything, but you never really delve in to know everything. Neurology kind of fell in my lap. I was doing some clinicals with Dr. Manhart when she was here at the neurology clinic, and she just reached out to me before she moved to Colorado and asked me would I be willing to come and work with them, that DC&D was going to be taking over the neurology unit here at Clinton. And I was like, yeah, I would love to, because I do like neurology. I did a lot of that in the ER, strokes and that kind of thing, but never did I realize that it was so intense and so much knowledge. I've built my knowledge so much just working in neurology.
So what does neurology mean? What do you do as a neurologist?
So it's basically the brain and spinal cord and nerves. We see anything from Alzheimer's, like neurodegenerative diseases, seizures, Parkinson's, migraines, Huntington's disease. We do get a lot of cervical radiculopathies, like pinched nerves in your neck or your back. We typically will start the workup, like do the MRIs, but then we will usually send them to like one of the bigger brain and spine centers.
What's typical causes of migraines that you find? I feel like migraines is pretty common, so give us some tips.
They are. So migraines are hereditary. So most people that have migraines, typically mom, dad, sister, brother, somebody had them. But things that exacerbate them, stress, lack of sleep, caffeine, hormones, a lot of those kind of things. Weather, a lot of people are triggered by weather and different foods.
Geez, so everything basically.
Existing.
Just existing. Yeah. So you cause migraines. Okay. So you've been at CMH for a while. You have always wanted to have a practice of your own. When did your mother's Alzheimer's become more apparent and like diagnosed?
First of all, there's probably a hereditary component to that. My great-grandma had Alzheimer's and my grandma had Alzheimer's. Although they have a lot of risk factors also. Like my grandma had carotid artery stenosis and she was a smoker, and that always is a higher risk for having Alzheimer's. My mom had a lot of coronary artery disease and had to have an open heart surgery. So we know once people have an open heart surgery that because you go on like a bypass machine, you don't get the oxygen to your organs like you typically would. That sometimes can set you up for having dementia, and especially if you already had a mild dementia to begin with. In 2015, she had open heart surgery, and things kind of just went downhill for her from then.
Okay. Are you one of her caregivers?
Not really. So we don't have caregivers that come in full time. My dad takes care of her 24/7. He will never put her in a nursing home. He's already said that he will take care of her till he can't take care of her anymore. They've been married for 60 years. I go over through the week when I can. I go over every Sunday and spend time with my mom so my dad can have a break. And then my son's girlfriend, we pay her to go twice a week to take care of my mom because she is a medical assistant. And she's done that for years, I guess, for like counsel aging and stuff. So she knows how to shower, and she goes and she helps my dad clean and do laundry and different things like that.
Nice. I think you mentioned that your sister and brother-in-law helped fund your new business. I was wondering if that was because they want to help support their mom in that way too, by supporting you to your new business.
So we've always had a very close family dynamic. So even growing up here in Wilmington when we were younger, our dad worked at Airborne. So before we moved here, he built houses with his brother. They had a building business. They built all those big houses like in Centerville. But when they got rid of their business, he came to work at Airborne. And so my dad has just always supported us. My sister worked at Airborne for years. I worked in the Sort Center before I went back to nursing school. Our dad has always just been the heart of everything. We could just walk out of the house and be like, here, do you need some money? Do you need this? Can we help you with something? We've just always had a family where we just depend on each other. And we know that if someone has a hard way to go, that someone's going to pick up the slack. And I've raised my kids the same way. You have to have a good family and you have to be able to support each other. And that's just kind of what we do.
So what's some of the things that your practice provides then?
First of all, family practice all the way around. So when you come see me, we're going to do a physical and an exam. And I'm going to spend probably an hour with you that first visit, going over all of your medications, making sure nothing is interacting. I'm getting my lab at the beginning of June. So pretty soon I'll be able to do lab work there.
You say lab, what does that mean? The whole room of beakers and stuff?
You're saying potions.
So, no.
Oh, I didn't say potions.
I know.
I said beakers.
I'll be able to draw people's blood to send to the lab to analyze, make sure that your liver function is good, make sure that your kidney function is good, because all of that kind of goes hand in hand with chronic diseases. So if you have diabetes, that affects our small nerves. So that affects our kidneys, that affects our eyes. So, we need to be making sure that your kidney function's good and you're not dehydrated. We need to make sure that your sugars aren't really high and you're not spilling sugar into your urine. So when I do some of my urgent care hours with patients when they come in, if we need to do urinalysis, I have urine cups there and I can dip urine, but now I'm going to have a lab where I can send it out and we can double check that and analyze it better.
So you say you're getting your lab. You don't mean you're going to get a lab on site. You just have a lab that you can access.
No, I'll actually draw people's blood. And then I'm using CompuNet. So they'll come and they'll pick the labs up when I call them and tell them they're ready.
Okay.
Is that what you're asking me?
I think so, yeah.
Okay.
So that, and then you also have telehealth too.
I do.
How did that start? Did you know from the beginning you wanted to do that?
I did. So again, I have a friend in Springfield who is doing the same kind of direct primary care, and she has guided me a lot and kind of helped me anytime I have questions, what do you think I should do, or should I incorporate this? But she kind of already had this plan going, and she does the same thing. And I see her. So not only do I believe in direct primary care and want to make it successful and provide things for patients and families in our community that can't get good health care or quality health care, I believe in that whole system because I'm a patient of a direct primary care physician also. So I think that telehealth is a great option for a lot of patients, especially if you don't live in town. So you come and see me, and then maybe your next visit, we can do telehealth. Not everything can be done by telehealth, but a lot of things can. And we have the pandemic actually to thank for that because telehealth came out of that. So,
yeah.
So what's your servicing area?
So I will see clients from anywhere. But as far as the home patients to go to their homes, I'm only doing our surrounding counties because if I did further, I would certainly have to charge a lot more. It wouldn't be feasible for me. Like New Vienna, maybe Hillsborough, Lynchburg, just kind of our surrounding outer areas.
Okay.
You said that one of the impetuses of starting this was your mother not being able to get medications filled because she couldn't go to visits. Obviously, you could have just had a primary care office that just did telehealth and meet that need. But there's a component of direct pay too that you're pretty passionate about. So why are you passionate about direct pay? Like, how is that beneficial to people and what does it do for you?
Yeah, so I think I'm more passionate about that because there's a lot of patients that can't even get insurance, right? So think about our economy right now. It's the worst that it's ever been. So many people can't get jobs, or if they do get jobs, it's part-time jobs, right? And they don't offer benefits. Or maybe they work for a small company that can afford to offer benefits. So this type of practice, it's very diversified. Anybody can use this practice. So whether you don't have insurance, you still can get good care because it's pretty affordable. If you have insurance and you have high deductibles, if you go to your family doctor and your insurance says, okay, it's $4,000 deductible per person. Every time you go to your family doctor, it's $40.
It's so confusing.
Right.
I hate
then
it.
you go see your family doctor and your family doctor's like, okay, we're going to do X, Y, and Z. All right, I want to see you back in 2 months. So in 2 months, you're paying another $40. So now you're up to $80, right? But now you have this big bill because you have a $4,000 deductible. So it's not just $40. Now you're getting like a $300 bill. So now you're in it for $380, right? And you're only like 2 months into seeing a doctor. So with me, you're paying me either $55 or $65 a month.
Depending on your age.
Depending on your age.
Yeah.
So 55 if you're under 50, 65 if you're over 50.
Mhm.
And you can see me 1 or 10 times a month. And if I see you and I'm like, okay, I really want to see you back in 3 months, you're not really paying me any more. You're still just paying that $55 a month, but you're not going to pay me $55. And if I want to see you in 2 weeks, you're not going to pay me another $55. It's one fee for everything. And I think that's the beauty of this type of practice, because so many patients can't afford to come in and pay $50 every time they come to the doctor, or $40. And some people can't even afford $20 in this economy. I mean, think about how high groceries and gas and everything has become. People are trying to get the necessities instead of taking care of their health. So my passion is I want preventative care, because that's where healthcare starts. It starts by somebody making sure that you don't get diabetes and telling you the right things to eat and exercising X amount of times a week. Because if you're not doing that, then you eventually get diabetes, right? And now you're into all of these medications and all of these health problems that go with diabetes. So that's what I love about direct primary care.
Your option, I think you mentioned before, it keeps people out of the ER too.
Yes. So again, going back to that payment model, if you're only paying me $55 a month or $65 a month, and now you have something going on, like you have a sore throat or you have a tooth infection or whatever, you can message me on my app. I have an app that I send you as soon as you sign up. I'm going to send you my app. It's Spruce app. It's HIPAA compliant. I'm going to send you an email with your payment options, and then I'm going to start your chart. And so that app, they can message me anytime, and I will answer you very timely. And then they may say, I think I have strep throat. I always get it. This is what I get, blah, blah, blah. Okay, well, let's send you an antibiotic. And then if you want to come in next week, you can. Or if you want to come in now, if you'd rather be swabbed, I'm happy to do that. Say it's a Saturday and your doctor's not in, I'm always in.
So people typically use the ER for things like that. They can't get scheduled in their doctor.
Correct.
So they have to go to the ER, and it costs.
Either the ER,
how much does that cost to go to the ER?
So it depends on your insurance. Yeah. So like some insurances to go to the emergency room can be $300.
Okay. That's a lot.
It is a lot. And to go to the urgent care, it's typically like $50 to $100.
Okay.
Yeah. So what you do have to keep in mind about direct primary care, it's probably not for everyone. I did have someone, so I post my stuff on Nextdoor, and I did have someone comment and say, I like this model. This is great, but this is probably not something I could ever afford, because they have government insurance, right? But that pays pretty much for everything. So you don't have co-pays when you go to the ER, the urgent care, that kind of thing. Their point was this: direct primary care offers more than just those conveniences. It offers the convenience that you have a doctor that's compassionate and that cares and is going to get you in and is going to spend time with you and is not regulated by another company that says, okay, you got 15 minutes to see this patient and then you have to see the next one. And you have to see 20 patients while you're here today. So I don't have to do that. And I can spend the time with my patient. I can hear what they're saying. And everything that you do in healthcare comes down to the history, hearing what someone says is going on with them. Because if you miss the history, you're going to miss the diagnosis. And how many doctors do you think has time to do that now?
Mm-hmm.
Not very many, because we're regulated.
Regulated by the insurance companies?
Pretty much your systems that you're working in. So a lot of hospital systems will say, okay, you have to see patients every 15 minutes, or you have to see patients every 20 minutes. 20 minutes is not enough time to see, especially in family practice. I'm fortunate that I work in neurology, which is specialty, but still, even in specialty area, it's not enough time, because nobody ever comes with one thing. They come with 5 things. Well, my blood sugars are high, my blood pressure is high, my cholesterol is high, I don't feel good, my stomach hurts. And you do not have time to address all of those things, unfortunately.
Yeah. So this model's not only good for patients, it's good for doctors, because they get to do what they love and they're not a factory worker. They're like they're a person having a relationship with somebody. It's
true. I used to say the same thing in the emergency room. When I worked in the emergency room, at the end, I was never so glad to get out of the ER. It had become where, okay, how fast can you get them triaged? How fast can you get them to the back? How fast can you get their blood? How fast can you get them either discharged, either up to the floor or out the door?
Yeah.
So nobody is looking at a patient as a person anymore. We're looking at a number. We're all looking at numbers because we want to make that dollar, right? So direct primary care is great for being able to hear your patients, do right by your patients. It's great for the physician because we get to spend time with our patients and we don't have to worry about missing things that should have been caught to begin with because we didn't have enough time to look into it.
You mentioned a patient who was an elderly couple who were a bit skeptical at first of paying this monthly fee, but then was like, this is the best thing ever.
I have a home patient at first talked to my daughter on the phone and was like, I don't understand why I would pay this when I have insurance. Why would I pay this monthly fee? This
How do they
seems
find
like
you
a
then?
lot. Facebook.
Okay.
So a lot of our patients have found me on Facebook and Instagram because we really didn't even have brochures out at that time, I don't think. And this patient had seen it on Facebook. And I think it was the daughter that actually seen it and reached out. And Chanda was trying to talk to them and help them understand how the system works. And they were very skeptical. And Chanda was like, okay, listen, I understand this is a different type of practice. How about you just let her come out and see you? If you don't like this system and you don't think it will work for you, we'll charge you X amount today. And then we'll just part our ways, which is what I did. And by the time I left, the husband was so thankful that I come out there. And he was like, why wouldn't I pay you this? Anytime I need you, I can call you. Anytime we're having problems, I can call you. And so he decided he was going to keep me, which he has. And I see them every couple of weeks. And then recently, that same patient had some issues. They couldn't get a hold of their cardiologist for 5 days. So I had to tell them what to do with their medications during that time. And I think you're seeing that in all healthcare now because the healthcare system is so overtaxed. It's not because we don't have great providers. And you'll hear patients' stories all the time. I couldn't get a hold of my doctor and blah, 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 blah. But if you're really listening to them, it's not because the provider's bad. They're just overwhelmed. The system is overwhelmed. So that's what I love about this. I don't have to be overwhelmed. When I get to a certain number of patients and I can't give that great care and I can't message you back within a couple of hours or I can't see you when it's convenient for you and me, then it's time for me to cap my patients off.
How would you help a family who has like little kids and stuff? What would you do for them?
So I actually do have a family that comes to me, the whole family, because I do offer family plans. This family loves it because you always have a doctor on call if you have an emergency with your kids or a question or you just need some answers. You have a doctor on retainer all the time, basically.
As opposed to like WebMD or something.
Right. You don't have to go to the emergency
An actual
room.
professional.
You search something that tells you you're dying.
Yeah.
Yeah.
Oh, my kids have cancer. What do I do?
We see that all the time. They love it because it's better than packing your kid up and taking them to the emergency room when maybe you just didn't even have to. Maybe some over-the-counter Tylenol would have helped or some ice and elevation, just some other good advice.
Yeah. Kids always getting sick.
Yeah. When it's your own kid, you panic, right?
Yeah.
Because you don't know what to do. Even if you do know what to do, sometimes you don't because it's your own kid.
Yeah. But how would you help someone like myself or Tia who are super healthy people?
Speak for yourself.
Never have any health problems. Then go to you and get diagnosed with the worst of things.
With direct primary care, I think that's one of the best things too, is that direct primary care focuses on prevention, right? So somebody like you and Tierra, it would be about making sure you're eating the right kind of diet and limiting your sugars and making sure you're exercising.
If you're going to tell me that, I'm not going to come to you. If that's what your advice is. I'm going to work out so I can eat as much sugar as I want to.
Yeah. Then you'll be definitely seeing me in the long run.
Oh, no.
Pre-diabetic. You're pre-diabetic.
Yeah.
I'm on the edge every day.
But seriously, it's more about education, right? I can't make someone do anything, but I definitely can educate you and let you know.
And scare you into it. I'm going to see in a couple of years, we all do this.
I use the word scare.
Educate's a better word than scare.
Yeah. Yeah. I definitely think education and prevention is what direct primary care is built on.
Then you're saving so much money in the long run instead of waiting for something awful to happen to you.
Right.
What is your proudest moment so far opening your practice? It's a big step and pretty awesome.
I would say I was very nervous at first. So I think my proudest step, honestly, was the open house. I was very overwhelmed by everyone that came and all the support from family, friends, and patients. And I think that's when it really sunk into me. This is real. This is happening right now. And things are going really well. And people trust me. And I'm thankful that they trust me enough to take care of them and make sure that they stay healthy. And that's a big commitment to trust somebody with your family that you love more than life. And that's what I say about my family. I tell all my patients that I have now, I'm going to treat you like I treat my family. And I love my family more than anything. So if I can't treat you well and do right by you, I probably shouldn't be doing this.
Mm-hmm. I was going to ask what keeps you motivated and passionate, but I think you pretty much answered it with that.
My family, my kids. Yeah.
What's a quote or piece of wisdom that's helped guide your life that you'd like to share with other people?
So I am a huge Mother Teresa fan. I love her. And I'm not even Catholic, but I love her. I love the quote where she says, we can't do great things, but we can do small things with great love. It's my favorite. All my kids will tell you that. I even told Shanda that you asked me that one day. And she says, oh, let me guess. And she came right up with it.
Nice. That's a good quote. It's empowering, I think.
It is.
It's kind of overwhelming to do something great, but to break it down, what does real change mean or look like to you?
Real change, I think, looks like something different than we're used to. Instead of just going along and accepting everything for what it is and, oh, that's how we've always done it. Real change to me is actually putting motion to it, right? And just showing people we're serious about this and we want to make some changes.
You're definitely making a real change with your new business model.
You are.
Thank you.
It's definitely going to impact our community in a good way.
Thank you. I hope so.
And at some point, I'll probably be seeing you.
Even if I tell you can't eat sugar.
Yeah. Hope you have like suckers in your
I do.
Do you? Okay. So
Don't eat sugar. Here you go.
yeah.
This is your
Maybe
first
I should
test.
get you stickers.
I've had friends say they've stopped eating sugar and they love it and they've gotten so much thinner and stuff. So
For me, this is completely off topic, but during Lent, I gave up caffeine and I barely have any anymore. And I used to have chronic migraines, heavily medicated for it, and not having caffeine has helped. Do I still get migraines? Yes, but not nearly as bad.
No.
So
You got to find that trigger.
it's actually a diet thing.
how do you
Really?
wean off of sugar though? Because I feel like sometimes I'm just like, I think for me, it's like I'm get so sad sometimes.
Oh, it's so hard to wean off sugar.
I'm
That's
just
my
going to get the
biggest thing
serotonin
too.
boost. Like,
Sugar's a drug. There's
It
a
is a
book out there
drug.
that kind of talks about how bad it is for us. I don't think there's anything wrong with sugar in moderation, but I think that in America in general, it contributes to a lot of the obesity, right? So a lot of patients that want to start trying to lose weight, I'm not calling you obese.
no, there's a backstory to that.
Okay.
But anyways,
A lot of people, when they want to lose weight, they're like, okay, I drink 5 pops a day. So they stop drinking pop and they lose tons of weight. And it's
Yeah.
all the sugar.
yeah, pop is
Yeah.
disgusting.
That's true. I don't like that either. But it's really hard because when you're going grocery shopping, you look at the nutritional facts and almost everything has sugar in it. Almost everything has sodium because
Yep.
it's preservative.
Yes.
But
Yep.
still, it's like I can't even eat crackers. Why does this have so much sugar in it?
Mhm.
That's true. You got to get
Peanut butter. Like
Peanut
40% of your daily intake of sugar. You have to go and look at the labels.
Yeah.
And then I look like a crazy person because I'm sitting there flipping labels while I'm trying
Is
to
it
shop.
peanut butter or just like the Jif?
There's a bunch of
brands?
different brands.
Like, is it natural peanut butter have sugar in it? Really?
I think it all has
No.
some sugar in it.
Okay.
Sorry, I didn't mean to break your heart.
So Tracy recommends eating space food, and
Yeah.
that's her diagnosis. Well, cool. How can people connect with you if they want to learn more about your services or become a patient?
So I have a Facebook. If they go to Tracy D Kelley Direct Primary Care, they can just Google that. They'll find me immediately. I think Instagram is the same thing. And I have brochures everywhere out in the community. I think there's some at Cava and Kairos, Kroger, the movie theater. And if all else fails, I have an email. It's Tracy D Kelley, DPC@gmail.com.
And you have office hours too. They can stop by.
I do. So Monday evenings, I'm typically there from 4 to 8, Wednesdays 4 to 8, and Saturday mornings, usually like 8:30 to 1.
Okay. Very cool. Well, thanks for being on our podcast. Appreciate it.
Thank you. Thanks for having me.
Well, that's it for our podcast today, folks. Hope you enjoyed our interview with Tracy Kelley. If you have more questions or ideas for her, please feel free to reach out to her directly. If she'll talk to us two dorks, she will certainly talk to you as well. We are a community of empowered individuals, after all. So, Tara, if people want to get in touch with Real Change Wilmington, how would they do that?
You can contact us on our website at realchangewilmington.com, visit our Facebook and Instagram pages, or pick up a copy of our free local newspaper at Kroger, Sam's Meat, and Fiesta Veracruz.
Very cool. With that, I'm your host, Dustin Pierce.
And I'm your co-host, Tia Harris.
Keep it real, Wilmington.